Hello, you're listening to Health Professional Radio. I'm your host, Neal Howard. So glad that you could join us today. Our guest in studio today is returning to talk with us about the art of chiropractic. It's Dr. Sarah Horsley, Doctor of Chiropractic, practicing in Georgetown, Kentucky, a graduate of a Bachelor's of Science degree in Biology at Morehead State University in Kentucky, and also a graduate of Chiropractic at Logan University in St. Louis, Missouri. And she's here today to talk with us about her particular philosophy, style of way of thinking when it comes to the art of chiropractic. How are you doing today, Dr. Horsley?
I'm doing great. How about you?
Doing very, very well. Thank you so much for returning with us today.
Mm-hmm.
You know, when it comes to chiropractic, you said that you had shadowed just about every specialty when it came to traditional medicine. While a student at Morehead University, you had shadowed many specialties in traditional medicine, and your intent was to go into traditional medicine, which is why you pursued a bachelor's in biology at Morehead State. Is that correct?
That is correct.
Now, what was it specifically that got you interested in chiropractic above and beyond having finally shadowed a chiropractic who had been working on your father? What was it about chiropractic specifically that really made the light go on in your head about the practice or the art?
She just went above and beyond with my dad. She spent that first visit that she was with him, she spent at least an hour going over his x-rays, explaining to him what she thought the underlying cause of his pain was. Mm-hmm. After his first adjustment, she called him the next day and asked him how he felt. It was just a very warm environment. My dad felt great about it, and it was just very touching to me that she took that much time.
Had the problems that your dad was experiencing, had he tried conventional or traditional medicine to deal with those problems prior to seeking a chiropractic?
He did. He had pretty much tried everything, and then this was it's his last. Well, if this doesn't help me, then there's nothing else. So it was his last stop.
Now, I'm sure as a doctor of chiropractic, you're familiar with the, sometimes, I guess for lack of a better term, the stigma that can be attached to chiropractic by many in the traditional medicine community. How have you dealt with that, and what is your what are your thoughts on that?
So, we do have they I don't want to say that they look down upon chiropractors, the other healthcare professionals, but it has been a bit of a struggle. It's frustrating when you have patients come in that their doctor has said, well, they didn't want me to try chiropractic because they don't believe that it works. But the best way that we handle it is to just get that patient better, because results are proof that chiropractic works.
So it really doesn't matter what the mindset of a person is when they finally come through your doors. The important thing is their mindset once they leave, and the fact that they will probably want to return.
Exactly.
Have you talked with any practitioners of traditional medicine about chiropractic, and talking about the combining of the two?
We have several practitioners that refer us patients because they know that for certain things it's better to take an alternative approach first. And we have a really good relationship with them, and then if we are unable to help that patient, we can refer our patients to them. So with a lot of doctors, we do have a really good working relationship with,
now, is that
which is always nice.
Is that something you say, which is always nice? Is that something that you've heard of that is not pretty much the norm? Does it depend on the region of the country or the school that someone graduated from? Are there any factors that you've been able to identify that contribute to this kind of a rift?
I know in St. Louis, chiropractic was a lot more, people knew about it a lot more and would go to that first before they went to their medical doctor. It was if I have back pain, I'm going to go see my chiropractor first. And then I noticed that once I moved back to Kentucky, it was kind of the opposite. Chiropractic is people's last stop a lot of times. So they tried the traditional approach, they tried this, they tried that, and it didn't help. Well, chiropractic's the only thing that I haven't tried, so I'm going to see them.
Okay. So it's kind of a different mindset depending on the region, or I guess the experience that the region has had with chiropractic over the years.
Exactly, yeah.
Because I'm assuming that word of mouth is a huge factor when it comes to discovering the benefits of chiropractic.
Mm-hmm. Definitely.
Now, when it comes to getting the word out, what are your main, do you rely on word of mouth or do you rely on those good relationships that you have with other traditional medicine practitioners with their contacts?
It's a good mixture of both. I would say that the best would be word of mouth.
Mm-hmm.
We would get most of our patients from referrals.
Mm-hmm.
So when we get somebody better, they're going to tell their friend, and then we'll be the first person they think of if that person's in pain. So that's probably where we get the majority of our patients. And I would say a small percentage we do get from other providers, but referrals from other patients is significantly higher.
Now, as in traditional medicine, I mean, just because there are 4 million general practitioners or 4 million ear, nose, and throat guys, all of those guys don't have the same philosophy of care. They don't see one way when it comes to treating a particular malady. Is it the same in chiropractic? Are there different styles of thinking or different ways of practicing when within a particular specialty?
Oh, definitely. There's some chiropractors that do just adjustment. Mm-hmm. They don't do any massage, any soft tissue work, any therapy, or any nutrition. It's just strictly adjustments. And then you have chiropractors that do a mixture of both. And I would classify myself as doing a little bit of everything, because I'm going to do whatever I can to help that patient, whether it's giving them a certain vitamin, have them get a massage with one of our massage therapists, or my soft tissue work or some therapy. But it would just be a combination of everything. But we do have patients that will get better with just adjusting. I just think it's better to do a little bit of everything.
Do you think that there are times when, just an adjustment would do for about 90% of the problems that people come in with? Or, as you say, is it better to be prepared for whatever might happen?
I would say, in my opinion, it's better to be a little prepared. You might be able to get that person better with just adjustments, but it might take longer. Mm-hmm. If you do a little bit more therapy here, a little bit more soft tissue, chances are they're going to recover faster from their condition.
Now, what is your particular philosophy when it comes to chiropractic? Does your philosophy have to change as you relocate, or is that something that's very personal to each doctor of chiropractic? Or does it depend on the patients that you're seeing?
I would say it depends patient to patient, because you might have some patients that, they don't really think it's going to work. So you have to try to change the way you treat them. My philosophy is to I want to treat that person. I want to get them better as fast as I can. I want them better and able back to work, back to enjoying their life, as soon as I can get them there. That's my goal, and then to keep them out of pain.
What types of things do you learn from patients as far as different problems? How much is a learning experience for you as well as your patient?
It's a lot. I mean, we have patients that come in. You have the more traditional patients. Mm-hmm. Low back pain is probably one of the most common things that we treat in neck pain. But then you have patients that come in with something completely off the wall that you've been able to help. Acid reflux, indigestion, allergies. And then, those patients are usually the ones that come in. They don't mention that to you, but it'll just be random. It'll be like, well, I noticed that ever since you've been adjusting my mid back, that my heartburn's gone. I haven't had to take my Nexium in a week because I haven't had any issues. And I've noticed that a lot.
So I guess in conclusion, your way of thinking or your chiropractic style would be to simply have an open mind, which is one of the reasons why you don't simply do adjustments. Yeah.
Oh yeah, definitely. You almost have to have an open mind with it.
Well, there have been many instances in traditional medicine where errors occurred due to just that, a lack of an open mind. When it comes to chiropractics talking with each other about a patient, you have more than one location, as you mentioned. When you have different doctors in a location, in several locations, what about the collaboration between doctors on a specific patient?
I can't tell you how many times that the owner of the clinic, she has been in practice for over 20 years. And so she has so much experience in this vast wealth of knowledge. And I can't tell you how many times I've been really stumped on a patient. Mm-hmm. And I'll call her and ask her what vitamins that she would recommend. And it's just nice to have that as, well, here's somebody that's been doing this a lot longer than me. She's probably seen this type of case 100 times, whether this is my first one. And that is just really great.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio today talking with Dr. Sarah Horsley, doctor of chiropractic, grew up in the small town of Olive Hill, located in eastern Kentucky, and after deciding to pursue a career in traditional medicine, studied at Morehead State University, where she earned a Bachelor's of Science degree in biology. But due to events that occurred to her during her senior year there, she decided to pursue a career in chiropractic, graduating from Logan University as such. And she's practicing now in Georgetown, Kentucky. And we've been here today talking with her about the different philosophies and ways of thinking when it comes to chiropractic, and how having an open mind is basically the only philosophy that she subscribes to. It's been great having you here with us today, Dr. Horsley.
Thank you so much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.